welcome to the health program on Trust Television. I'm Aisha Salihu. On this episode of Healthy Living, we'll take a holistic approach at the antimicrobial resistance strain around the world, following the commemoration of the World Antimicrobial Awareness Week starting from 18th through 24th of November. Fighting AMR is said to be a global endeavor and must be addressed through a One Health approach. To curb it effectively, all sectors must join forces and encourage the prudent use of antimicrobials as well as preventive measures. This is why this year's theme calls for collaboration across sectors to preserve the efficacy of these critical medicines. As a global challenge and phenomenon, Nigeria joins the rest of the world to flag off the week with efforts laid down by the Nigeria Center for Disease Control and Prevention in collaboration with the Federal Ministry of Agriculture and Food Security, Ministry of Environment, and Ministry of Health and its partners.
Antimicrobial resistance is a public health crisis that poses a significant global threat and can cause millions of deaths. The discharge of antibiotics and other antimicrobial compounds, such as disinfectants and heavy metals, into the environment has the potential to drive the evolution of resistant bacteria. These compounds are present in water, soil, pharmaceutical industrial effluent, and hospital waste. At varying concentrations, municipal waste contains substances that drive antimicrobial resistance in bacteria, such as pharmaceuticals, household products, hospital waste with high concentration of antibiotics and disinfectants, and industrial waste that contain heavy metals. Antibiotic residues discharged into the environment also contribute to the development of antibiotic resistance bacteria that can easily spread around the world through trade and travel and drive resistance globally.
We are not just to kick off this WOW 23, but raising a toast to our approach and maintenance of this year WOW theme, preventing and minimizing antimicrobial resistance together. But having said these achievements, we should also not forget that AMR has really, it's a serious concern. It has really affected our health, economy, and development. In terms of health, almost 64,500 deaths, they are attributable, and 263,400 deaths which are associated with AMR. This is alone in Nigeria in 2019 as per the study. Regarding the economy, the GDP loss attributable to AMR in developing countries, including Nigeria, has been forecasted to be 5 to 7% by 2050. So that's a big concern raised, and so we need to also focus AMR. In terms of how AMR is linked with different sustainable development goals, I think AMR is central. It is not contributing, but it is also going to achieve, it will also contribute in burden and also in achieving some of the sustainable development goals. I am just trying to highlight here, these are SDG 1, which is no poverty, SDG 2, which is zero hunger, SDG 6, which is clean water and sanitation, SDG 8, decent work and economic growth, SDG 12, that is responsible consumption and production, and SDG 7, which is partnership for the goals. These are directly attributed to AMR. So AMR is not just health, but it's economy, and it also affects the development. So the WOW 2023 is an opportunity to come together, raise awareness, and strengthen the One Health approach. So I urge all to pledge to preserve the efficacy of these important antimicrobials and the related products together.
Factors such as low level of health awareness, lack of access to clean water, sanitation and hygiene, poor infection prevention and control practices, poor waste disposal practice are believed to likely contribute to antimicrobial resistance. We can't take away self-medication from the equation, especially for the misuse and overuse of antibiotics. Now let's now join a pharmacist who gives his take on this practice and its resultant effect on antimicrobial resistance.
The point is, it is factual that there's a lot of antimicrobial resistance. And like you said, it's due to overuse and misuse of antibiotics. And most of it is because of the low awareness, health awareness of people. When people are sick, they just walk into a pharmacy or into a chemist, sometimes even roadside drug sellers, and just buy any antibiotics, mostly ampiclox, ampicillin, and use anyhow. And then in the long run, people come down with antimicrobial resistance. And that's because there's little or no health awareness. So the government of the day should find means to educate people on their health, especially when it comes to the use of drugs, and most especially antibiotics, because misuse and overuse of antibiotics will definitely lead to resistance, and it will affect the outcome of therapy in many cases. Antibiotics should, though they are not a prescription drugs that have to be prescribed, they are OTC drugs. OTC is over the counter, yes, but at least there should be a recommendation from a healthcare practitioner, not necessarily a doctor's prescription. A pharmacist can recommend, nurses and other healthcare practitioners can recommend. Citizens should not just walk into a chemist or pharmacy and just make demand for antibiotics, because if you come to us and you ask for any antibiotics, we'll sell for you. They are OTC drugs, but you should tell us what is wrong with you, and then we'll prescribe the right dose and the right antibiotic for that particular illness. So people should be sensitized on this. Yep. My message goes to our colleagues at NAFDAC. Yes, antibiotics are specialist molecules. They are important medicaments. Not everyone should be allowed to sell antibiotics. Chemists can sell paracetamol, they can sell some antimicrobial product like Flagyl, but they are very important antibiotics that chemists should, roadside chemists and drug peddlers should not be allowed to sell. So that's to NAFDAC. There should be proper regulation guiding the distribution and sales of antibiotics. And then my next message goes to pharmacies. When customers walk into pharmacies and request to buy antibiotics, we should go the extra mile to ask customers what they want to use the antibiotics for, and then do proper recommendation and then counseling.
Use of antibiotics are widespread around the world. In our country, we have continued to have a challenge with AMR strains due to the current regime of use of antibiotics across board. From the surveys that we've done, we are seeing a lot of resistant strains. We're even seeing some organisms that are very difficult to treat with the current available list of antibiotics that we have in the country. And this is a cause for concern for all of us and for all Nigerians. As partners, we're happy to support the country in driving this initiative forward. Through the years of our partnership with the NCDC and other government agencies, we've been able to bring to the fore the issue of the AWARE classification, which is the Access, Watch, and Reserve groups for antibiotics. And we believe that this effort, which the Federal Ministry of Health has championed, is one of the ways that when the classifications are incorporated into the essentials medicine lists at the national level, that we can be sure that prescriptions do not target antibiotics that can easily go bad or that we need in the most critical patients who are in the intensive care units, etc. So we're happy that this process is moving forward, alongside other processes that we've also been happy to be a part of, like the development of the national plan for antimicrobial stewardship, using a One Health approach, which we also supported, as well as the development of other national plans like the National Plan for IPC and other important documents for containing diseases across board.
Following the inauguration of these respective governance structures for the AMR response in the country, a One Health Action Plan, the NAP 1.0 now, was developed in line or in alignment with the Global Action Plan. And this was done, of course, with great contributions from the host ministry, which is the Federal Ministry of Health and Social Welfare, but also the Federal Ministry of Agriculture and Food Security, Federal Ministry of Environment, Federal Ministry of Water Resources, and other stakeholders, both in government and non-government sectors, including our multilaterals and others. Currently, Nigeria reports AMR data to the Global Antimicrobial Resistance Surveillance System that is called GLASS. We've been doing that for 6 years now, having started in 2017. And we, of course, report animal antibiotic consumption data to the OIE, which is now known as the World Organization for Animal Health. These data guide the management of infections at healthcare facility level and policy decisions through a two-way feedback mechanism. In 2022, the then Honorable Minister for Health, Dr. Zage Ehanire, on behalf of the country, signed the Muscat Declaration, which targets to achieve the 2030 SDGs through the following: ensuring zero use of very critically important antimicrobials for non-veterinary medical purpose in animal sector, a 30 to 50% reduction in the quantity of antimicrobials used in the agri-food system, and at least 60% antibiotic consumption in humans that are within the access category of antibiotics. And the aim is to achieve all of this by 2030. Earlier this year, the NCDC, in collaboration with the One Health Ministries and with support from the quadripartite development partners, WHO, FAO, the World Organization for Animal Health, and UNEP, commenced the development of the next 5-year AMR NAP, which is the 2.0 now, to cover the period 2024 to 2029. It is also my utmost pleasure to inform you that at the recently concluded joint external evaluation, one of the results or findings was that Nigeria has significantly improved on its READY score, achieving 54% compared to the 39%, which was the result of the first evaluation of our health security capabilities in 2017. While this is a significant gain, having moved from 39%, which suggested that we had little or no capacity in many of the technical areas assessed, including AMR and the One Health response. Beyond the number, what it suggests, if you assume 100% is the perfect score, is that we still have significant gaps in our health security capabilities, including in One Health, including antimicrobial resistance. And every gap that we have in our health security capabilities is a gap that is a threat to human life. It means that we have public health threats, including antimicrobial resistance, which is really a silent pandemic, growing without an adequate response and threatening human health, animal health, and of course, the environment that we share with these creatures. As far as AMR was concerned in this JEE, the National AMR Multisectoral Coordination moved from level 2 to level 4, while antimicrobial stewardship moved from level 2 to level 3. This indeed is a great achievement for Nigeria in its efforts to respond to not just global but also national AMR threats. And to take things further, the recommendations from that JEE, even if the result is being finalized, has already been incorporated into the draft NAP 2.0, just showing our readiness and commitment to move the needle even further in the fight and in the response to AMR. Some of the recommendations from the JEE include, and they were also aligned with global priorities, is the generation and utilization of nationally representative quantitative data on antimicrobial resistance and, of course, antimicrobial utilization. We've got a gap, a data gap in terms of this, and without having a full representative data, we are still challenged in terms of advocacy efforts to get the necessary action for policy actions, and even to attract the resources that are required to tackle this really big problem. The other recommendations include strengthening private sector involvement in AMR activities. Again, we've talked about AMR being multi-sectoral, One Health being a multi-sectoral activity. And when we say multi-sectoral, we're not only referring to the government sector. It's an all of government and all of people response. So we need both the public, all government, and indeed the private and even non-governmental sectors, and of course the population, the communities of fellow citizens that we all serve. Others include integrating multi-sectoral AMR surveillance and response activities.
Still talking about antimicrobial resistance, that is AMR, I have joining me virtually at the moment to shed more light, perspectives and insights on the topic of discourse. I have joining me from the Nigeria Center for Disease Control and Prevention, Dr. Abiodun Egu-Enu, who is the AMR Program Coordinator at the Center. Thank you so much for joining us on the program. Welcome to the program.
Thank you for having me.
Now, I'd like to start you off with, we have been talking about antimicrobials. I'd like to hear from your own perspective. Give us a deeper insight to what antimicrobials are.
Antimicrobials are medicines. They are agents that we use to control infectious disease in humans, animals, and plants. And when we talk about resistance, it is not resistance of the human body. The resistance of common organisms, bacteria, viruses, parasites, to these antimicrobial agents, these medicines that before they were responding to. So when there is an untreatable infection, that is when we talk about antimicrobial resistance. So antimicrobials are actually medicines that are used to treat infections.
Now, I understand that the antimicrobial resistance is a silent pandemic if we don't address this particular matter. But then I know that in commemoration of this week, just like earlier within the week, the DG of the NCDC had flagged off this week and he talked a lot about it. But just, for you to, as a way of summarizing it, what would you say has been the resistance strain in the country over time?
So there are several infections that are already showing resistance. One of the common infections is malaria. So you would have heard in the past that Nigeria or countries are using some newer agents, for example, artemisinin combination antimicrobial agents. This was because in the past, malaria was becoming resistant to chloroquine. And also we have seen resistance to infections such as HIV and tuberculosis. Particularly of importance is bacterial organisms. These bacterial organisms are varied. There are so many. They cause bloodstream infections, chest infections, urinary tract infections, and are particularly worrisome in children and in pregnant women and older age. And we have been noticing that these infections are no longer responding to treatment as they should in Nigeria and even globally. So in Nigeria, in 2019, our data shows that 64,500 people's deaths were attributed to resistant infections, and over 200,000 were associated with resistant infections. And children under 5 are at the highest risk of these infections. And Nigeria has one of the highest age standardized mortality across 19 countries. We are the top 6 countries, one of the top 6 countries contributing to these deaths. So it shows that AMR is a silent pandemic. It's killing a lot of children and also affecting economies and livelihoods.
Now, I was going to actually ask you, according to the statistics from the WHO, where they said about 4 priority antibiotic-resistant pathogens are detected in Nigeria. I know you have stated a number of infections. Now, I'd like to know, what then is the way forward for the country? You did talk about its effect on children who are under the age of 5. We have the prevalence of malaria year in, year out. We keep talking about malaria, and then we depend on antibiotics, some of these antibiotics as treatment. What would you say in your capacity is the way forward for the country?
So one of the key things is that we use antibiotics irrationally, we misuse them. People should not take antibiotics except a doctor has prescribed and after doing a test. So if you are not feeling fine, you need to go to the hospital. Fever is not a symptom of an anti-malaria deficiency or an antibiotic deficiency. Fever is a symptom of an infection, and not all infections require the same type of drug. Because you've used a particular medication before or your family has used that same drug doesn't mean that is what is affecting you now. So anyone that is ill needs to go to a hospital so that a licensed practitioner can see him or her and the appropriate test can be done. In addition, some of the pathogens that we should be aware of in Nigeria, for example, an infection called Streptococcus pneumoniae, there are already effective vaccines for this. So we should go for our vaccinations, especially children, because children are at higher risk. Hand hygiene is important, washing of our hands regularly after eating, after going to the restroom, and after taking care of animals. And for farmers out there, before you use any antibiotics for your animals, go to a licensed veterinarian. And if your animal has to take some antibiotics and later needs to be slaughtered, for example, food of animal origins, you must ensure that you follow what we call withdrawal period, where you allow the animal to metabolize the antibiotic before it is sold and killed for consumption.
I understand you have talked about the people that are responsible for all of this, but then again, I like to point you to the direction of the fact that some of this microorganisms, this microorganisms, from the flag of the commemoration of the week, I understood that even from the Ministry of Environment, where they talked about the indiscriminate disposal of waste, pharmaceuticals, and all these other laboratory waste and other waste that come from the health facility. You did talk about people taking the responsibility of going to the health facility to get tested and ensure that there is adequate treatment being prescribed or recommended and the dosage followed in total. So what would be your advice to health facilities, because we know this is affecting the environment, it's affecting animals, and it's also affecting humans?
So in the healthcare facility, waste must be generated because as human beings, we always generate waste. In the health facilities, there are incinerators. So majority of all of health facilities, and I know that government is working with all health facilities in Nigeria to ensure they have access to safe areas where they can dispose of waste. So health facilities should follow the laid down procedures and protocols by regulatory agencies, ensuring that waste is properly segregated. One of the key things that NCDC has set in place is having an infection prevention control program that from the national level down to the health facility and state levels. So within this IPC framework, incinerators have been provided to hospitals, especially during the COVID-19 pandemic. A lot of hospitals have been upgraded and they now have these facilities. So it's for them to now use these facilities, leverage them, and properly dispose of waste generated in hospitals. And even for antimicrobial agents, there are procedures and guidelines provided by NAFDAC. Hospitals need to follow these guidelines.
Now, lastly, before I let you go, I'd like to know, we know that there is the overuse and misuse of antibiotics, which has greatly contributed to the antimicrobial resistance, right? So I'd like to know from your perspective, what do you think people who dispense these drugs, I'm talking about pharmacists, I'm talking about the roadside chemists that we have, I'm talking about people, the pharmacists within and outside of a particular health facility, what do you think they need to do better, in line with the ethics of the profession, just so they ensure that they don't perpetuate or aid people using these drugs inappropriately?
So there is a national drug policy that exists and already states that only a licensed health provider should dispense, and only a licensed health provider should prescribe. Anyone that goes to take antibiotics without proper licensing and proper treatment, he or she also is incurring additional costs. Because if you do not take the proper medications at the proper time, you spend more funds or spend more money to take care of yourself in case it becomes untreatable. So for those that are out there, the regulatory agencies that are already mandated to ensure that those that are not licensed or unlicensed premises are not in possession of such drugs. For licensed professionals, please follow the ethics of your profession. The ethics says that you should make sure that people receive adequate testing and that should provide antibiotics that are registered and licensed by the country. So we should follow the ethics of our profession.
Thank you so much for joining us. We have been speaking with the AMR Program Coordinator at the Nigeria Center for Disease Control and Prevention, Dr. Abiodun Ego-Enu. Thank you for your time.
Thank you for having me.
Strengthening infection prevention and control in healthcare facilities, farms, and food industry premises, ensuring access to vaccines, clean water, sanitation and hygiene, implementing best practices in food and agriculture production, and guaranteeing the sound management of waste and wastewater from relevant industries are critical to reducing the need for antimicrobials and minimizing the emergence of transmission of AMR. That's about it on this episode of the program. Remember, you can join the conversation by following and subscribing to all Trust TV social media platforms to drop comments, contributions, and suggestions. Join us again on another episode of the program. I'm Aisha Salihu. Thanks for your time.